One Canine is a project that we have collaborated with TGen North, so that's Translational Genomics Institute, and they are a nonprofit research institute that does a lot of genomic sequencing and COVID testing in the state of Arizona. What's really cool is that the Arizona Humane Society has collaborated with them to help test 1,000 dogs in our state for over a 2-year period for COVID-19. What's really interesting is that a lot of people don't know that dogs can get COVID, and what we're trying to do with this project is find out more about how COVID affects dogs, including which dogs are affected by COVID. So amongst these 1,000 dogs, we're trying to get different populations. So that includes shelter dogs, which is why the Humane Society is involved, companion animals, so just normal pets. We're doing herding dogs, farm dogs, dogs from tribal reservations, and dogs that are free roaming. We're also testing therapy and service dogs and police and working dogs. So this is a huge effort so that we could try to figure out, we know that dogs can get COVID, but what populations might be more affected now that we're after the main sort of pandemic period. We performed a project during the pandemic itself solely in households where someone had tested positive for COVID-19. We found that 36% of pets, that was dogs and cats, had tested positive. That's a very good question. I really think that the study is going to impact veterinary medicine in a big way, because we're going to allow veterinarians to better understand how the disease affects dogs and give them better suspicion as to when they should or should not recommend testing a dog for COVID-19, because it's not really a common part of a canine respiratory disease panel. It also helps veterinarians be able to guide pet owners on how to best interact with their pets if they get COVID themselves. So, for example, how much interactions should you be having with your pet? What type of interactions potentially? Or should you not have your dog out and about interacting with other animals? I think the Arizona Humane Society does a fantastic job of making sure that infection control and infection prevention is done so that we don't spread illness from dog to dog. But we also are aware that there are some things that we can spread to them, so COVID-19 is one of them. And since we know that people can be asymptomatic, we're just curious, is there a risk for potentially dogs being exposed or testing positive if they came out from the community, if they came from a hoarding situation, or just because of the number of people that they interact with on a daily basis. We're just curious to know what's that baseline amount that we may see positive. And say, for example, there is a respiratory outbreak and the dogs are tested for kennel cough and that comes back negative, that would maybe put into our minds, maybe we should test for COVID-19. That could potentially be something that could be an issue in the shelter setting. And so I think the Humane Society is doing a wonderful job of contributing that data to science, and it's also not only going to help the dogs, but it's also going to help people as well.